Good afternoon. Welcome to today's health education class, Stress and Brain Health. Today's presentation is by Stephanie Ramirez, and I'm going to turn it over to Stephanie and let her introduce herself and the role that she plays in the hospital. Stephanie?
Thank you. As she said, my name is Stephanie Ramirez. I am a speech-language pathologist here at North Kansas City Hospital. I work in both the outpatient and acute settings. So I have worked with patients dealing with a variety of brain issues, from dementia to concussion. And obviously, stress plays a big part in brain function. And so that's why I'm really excited to be able to talk with you about this topic today, because I think it's important for everyone to understand. And if you would like to ask a question as we go, feel free to type it in the chat box, or I will open it up for questions at the end. This presentation is also being recorded, so you can watch again later when it is posted on the hospital YouTube channel. So for today, just a brief 30-minute presentation here. We're going to talk about stress and brain function, what chronic stress does to our brain, and then end with some stress management strategies. So hopefully you leave today with some tools that you can implement to help you manage your own stress. So as it is defined, stress is a feeling of emotional or physical tension. It can come from any event that makes you feel frustrated, angry, or nervous. This is our body's natural reaction. It's kind of that fight or flight response. So it historically has been very positive in keeping us away from dangers and helping us to get through some of those challenging situations. But the problem comes in when that stress is prolonged or it lasts for an extended period of time. That's when stress turns into what we would consider anxiety. And that can lead to some changes in our brain. So in thinking about stress in our daily lives, there are 7 main sources of stress. So you might feel like you're under a lot of pressure, big changes in your life. Maybe you're moving, maybe you're starting a new job, worried about something, feeling like you don't have as much control over an outcome or a situation. I know a lot of my patients feel that way. Feeling responsibilities that are a little bit overwhelming. Feeling like you don't have enough work, activities, or change in your life. Maybe you're not getting enough stimulation, experiencing discrimination, hate, or abuse, or if you're going through a period of uncertainty. So I want you to take just a moment for yourself to think about maybe which one of these 7 sources of stress do you feel like is impacting you the most right now? Because a lot of times understanding where our stress is coming from is the first step in addressing that stress and helping to take better control over it. Some signs that you might be having some stress in your life: you might notice changes in your sleep. Certainly you'll notice fatigue, sometimes body aches from some of that tension that we're holding in various places, pain, anxiety, irritability. Maybe you have a shorter fuse than you normally do. Again, that tension, and then headaches can also be a sign of stress. Now, there is no medical, quote, test for stress. So physicians pretty much look for some of these symptoms and then use those to help, diagnose different, stress syndromes and things of that nature. So there's no medical test, but we just have to go off of what you're experiencing. Now, how does that stress manifest in the body? So when we have that fight or flight response, there are some hormones that are released, epinephrine and norepinephrine, a little bit of a tongue twister. And those result in increased blood pressure. They speed up your heart rate, they raise blood sugar levels. Again, it's that survival mode. that you go into. If those hormones are present for an extended period of time and are more chronic, you might notice digestive problems, problems with fertility, urinary problems, and a weakened immune system. So you might find that you're getting sick more often than you used to. And in the brain, the amygdala is the part of the brain, and you can see it in that graphic there. It's right towards the midbrain that processes threatening situations. So people who are chronically stressed on brain scans, they tend to have a larger amygdala than those that do not have chronic stress. Right next to the amygdala, you can see that there is the hippocampus there, and that's the brain that is involved in rational thought and planning. So when we're trying to do those higher level thought processes, if that amygdala, that fight or flight, is in control, then those higher level thought processes are not going to be as good. They're going to be reduced, and that hippocampus actually appears smaller. It's basically our body prioritizing what it's going to do. You can't do everything. And so if that amygdala is telling us that we're in trouble, then all of our energy, our resources are going to go there. And then that makes that hippocampus not as effective as it normally would be. So how does that affect us? That hippocampus is pretty important. So again, you might notice changes in your memory, difficulty concentrating. You might notice that some activities like work or reading or, sitting down and balancing the checkbook make you a little bit more tired. Maybe you get cognitive fatigue, difficulty learning new information, difficulty making decisions, poor judgment, and then depression, anxiety. Again, those I would say are kind of compounding because of all of these other things. So again, with the changes in the hippocampus, these are the things that we can look for as signs of stress in the brain. So in managing stress, there are several things that we can do, and that's what I want to spend most of our time talking about today, because again, that's going to be what you want to take away from this talk. So first of all, self-care, and we're going to dive into each one of these in some more detail. What does that look like for you? It could be different from one person to another, so I'm just going to give you some examples and some ideas there. Taking rest breaks during your day. I know we typically stop taking naps when we're about 5 or 6 years old, but I think everyone could benefit from a rest break. Maybe not sleeping, but just really closing our eyes in a dark, quiet place and just really reducing that stimulation to our brain so we can back down a little bit. Healthy sleep is essential for brain function and for managing stress. Increasing exercise is definitely a good stress buster. Eating a healthy diet. Self-talk is one of those things that's a little bit easier said than done, but we're going to talk a little bit about that as well. Making sure that you're managing depression, anxiety are very important. So if you are dealing with those things, it's definitely worth talking to your doctor about and seeing what they would recommend. Setting boundaries is going to be very important. We're going to talk about that as well. You can't do everything. And again, our brain is going to prioritize what it deems to be most essential. And so we really want to focus on those things that are most important by setting some good boundaries. And then finally, implementing some relaxation techniques. And we're going to end with some of those today. So again, self-care looks different for everyone. But in general, we definitely want to do these 4 things. So we want to stay connected, having a good social network, finding people who keep you happy, who keep you calm, who you can discuss those worries with, who might help share some of those responsibilities so that the things that you have on your plate aren't as overwhelming. Are great. And again, I think this is one of those areas that with COVID, we've definitely seen it become a little bit more challenging. So I like to remind people that, in this day and age, it doesn't have to be face to face if you're not able to get out and about. You can still stay connected. There's online support groups, there's, social media and healthy doses, and focusing on some of those positive things. I know it can be a little bit of a slippery slope on there, but it can be helpful. Zoom or FaceTiming with friends or family that might live far away. A simple telephone call can be all you need just to have that connection. Or writing letters. Who doesn't like to get a letter in the mail instead of a bill? So I think just finding ways to stay connected with others can really be good for our self-care and help manage our stress. We don't feel like we're going it alone. And I'm sorry, the picture is kind of overlapping the text there, but eating well, getting good nutrition is really important. So we have to fuel our body and our brain. So typically what I like to tell people is when you're thinking about your diet, heart health equals brain health. So if you're eating a heart healthy diet, that's going to be really healthy for your brain as well. So really focusing on fresh fruit, vegetables, that says lean protein and healthy fats. So just a nice balanced diet, and really thinking about limiting your sugar, caffeine intake. Again, that does kind of hype up your brain a little bit more. And so if you're already stressed, sometimes that can make it a little bit worse. So thinking about reducing those, or at least consuming them in moderation. Sleep, again, very important. Some people might think skimping on sleep is going to help them get more done, so then they'll feel better and less stressed. It's actually the opposite. So you're going to be less productive. You're not going to be able to get as much done. And sleep is kind of our brain's opportunity to reset. And so we really want to make sure, at least 6 to 8 hours per night. If you're having trouble with sleep, there's a whole other talk on sleep hygiene that I've done in the past. You can check that out. You can Google sleep hygiene strategies, or you can talk to your doctor. There's lots of different testing they can do to help make sure that you're getting a good night's sleep. And if there's anything that you need to help you with that, then they can recommend it. So definitely think about your sleep health. Setting up a sleep routine. So you're going to bed, waking up at the same time every day, and you'll set yourself up for success. Exercise is also very important. Exercise releases other hormones that can help calm us down and make us happier. So aiming for a minimum of 30 minutes on most days, even if you have to break it up to 3 10-minute sessions, is ideal. So it doesn't have to be anything super, super strenuous. Even just a short walk can really boost your mood. And if it's outside and you're getting some sunlight and vitamin D and you're walking and talking with a friend at the same time, you get bonus points. So thinking about ways that you can incorporate movement, gentle exercise in your day. Yoga is also really great because it's calming. It focuses on breathing, but it also does help exercise your body as well. So there are a lot of really good free yoga videos on YouTube. So definitely check those out. It can be something that you can incorporate into your daily routine. Now, moving from self-care to self-talk, again, this is a little bit easier said than done. So thinking about staying positive, practicing gratitude, acknowledging the good parts of your day. So I was actually watching an interview with Hoda the other day, and I think it was her, she said that she has started, before she even gets out of bed in the morning, practicing thinking of one thing very specific that she is thankful for, or that she is, that went well. So it could be very small, but it needs to be specific. So thinking about doing that before you even get out of bed in the morning starts your brain off in more of a gratitude frame of mind instead of worrying about what's coming. So that can be something that you do even before you get out of bed in the morning, and taking a moment to think about what you've accomplished, not what you didn't get done when you're going to bed at night. So thinking about, wow, today was really busy. I was able to do X, Y, and Z. Anything that didn't get done, we'll just save it for tomorrow. But really giving yourself credit for what you have accomplished can be helpful. In my therapy, when we're working on some of these cognitive issues that people experience after a neurological event, we talk a lot about accepting the things that you can't control and focusing on what you can control. So we talk about kind of the spheres of control. And so, what you wear every day, that's something that you can completely control. What other people think or do, you have no control over that. So really thinking about ways to let go of situations that you can't change. And again, that's easier said than done, but if you can practice that and kind of acknowledge, kind of start off by saying, is this something that I can control? Yes, then I'm going to focus my energy on that. Is this something I can control? No, then there's no sense in worrying about it. I don't have any control. So really thinking about reframing your mind. And if you find that this self-talk is particularly challenging, I would really encourage talking to a licensed therapist or your healthcare provider, because there's a lot of resources out there. And there's a lot of tools that you can use to help kind of work through some of these negative thoughts and maybe make them more productive, more positive. So, a lot of my patients, even while they're coming to me for cognitive rehabilitation, also see some kind of therapist or counselor for their emotional health. And they wind up doing better in therapy because they're taking care of their brain and they're taking care of that emotional response, which again, we learned how stress can affect your brain. So because they're taking care of that, they do better in my therapy as well. We talked a little bit earlier about setting boundaries. So first of all, setting goals, I think, helps to narrow, your to-do list down and make you feel more in control. So think about prioritizing those things. What do I have to get done today? What can be put off until next week or next month? And maybe delegating as well. So is this something that I have to do, or can I have someone else help me or do this for me? I think that is really helpful in the long run because we can't do everything. So reaching out, having someone assist you with what they can is a great idea. And then earlier, learning to say no, I think is also very challenging. It's something that a lot of us don't like to do. But if you're busy or stressed, taking on more responsibility is not going to be good for you. And it's probably not going to be good for whatever you're trying to get done. You're probably not going to do the best you can. So you can put it very diplomatically. You can say, hey, I've got a lot on my plate right now, and I want to give this project my full effort and energy, and I don't really feel like I can do that right now. So I'm sorry, I can't help you with that. It doesn't have to be anything abrasive or negative, but just gently turning somebody down, saying no, it can really help you in the long run. Whoops, sorry about that. Get that back up. Oh. Hold on a second. A little bit of a technical difficulty. And we're back. Sorry about that. All right. So saying no and setting your boundaries. So we're going to finish today with just a few relaxation exercises. And these ones I love because you can do them anywhere. So if you're, at home, if you're in the car waiting, to go into an appointment that you're nervous about, if you're at work, you can do all of these. So the first one we're going to talk about is box breathing. So everyone, this is audience participation portion of the presentation here. So go ahead and sit up tall in whatever chair you're sitting in and slowly exhale all the way. And we're going to inhale for a count of 4. 1, 2, 3, 4. We're going to hold. 2, 3, 4. Exhale. 2, 3, 4. Hold. 2, 3, 4. So we have that box breath. You can visualize 4 in, hold for 4, 4 out, hold for 4. And you can repeat that as many times as you want. I think deep belly breathing oxygenates your brain. It can help reduce stress, bring down your heart rate. So I suggest for my patients, doing some deep breathing 3 to 5 minutes per day is great. This is another one you can do before you even get up in the morning. So we'll try it one more time. Everybody breathe in and out, one for free. Good, and then we're gonna inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4. And the counting actually is really helpful as well, because a lot of times when you're trying to focus on counting, you can't focus on whatever was stressing you out. So kind of a little bit of a distractor for your brain too. So some deep belly breathing, box breathing, excellent relaxation trick. Next is the progressive muscle relaxation. So this is where you start by sitting down or laying down, and we're really going to think about relaxing our entire body bit by bit. So we're going to do this together. For the sake of time, I'm going to go a little bit quick, but again, at home, you can go as slow as you need. So you're going to take one deep breath in and out. And then you're going to lift your toes upward. Really feel that tension in your toes and your feet. And then let it go. And you're going to pull your toes downward, push into the earth, hold it, and then let it go. Notice how it feels different. Next, you're going to tense your calf muscles and then let them go. Feel the relaxation. Move your knees toward each other, push, 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 and then let them go. Squeeze your thigh muscles, then let them go. Clench your hands, then let it go. Tense or flex your arms, then let it go. Squeeze your bottom, then let it go. Contract your abdominal muscles, then let them go. Inhale and tighten your chest. Hold. And exhale to let it go. Raise your shoulders up to your ears. Then let them go. Purse your lips together really tight. Then release. Open your mouth wide, stretch that jaw. Then let it go. Close your eyes tightly. Then release. Finally, lifting your eyebrows, feeling that tension in your forehead, and then release. So I paused for about 3 seconds. You can hold for up to 10 seconds, whatever feels good at home, but we really worked all the way from our feet up to our head, relaxing every muscle in your body. This is a good one, especially if you feel like you have trouble falling asleep at night. You might use this one to help relax you before going to sleep. And a lot of times my patients tell me that before they get to the end, they wind up falling asleep. So it can be very relaxing. All right, our last one is going to be some guided imagery. This one I'm just going to talk about since we only have about 5 minutes left, but basically you're going to, again, sitting in a comfortable chair, deeply breathing, imagining something that is very peaceful. So for a lot of people, that might be the ocean, the mountains, a forest, something that makes you feel relaxed. And most of the time we try to do this out in nature and really see that scene in your mind's eye with as much detail as possible. What do you see? What do you smell? What do you hear? Think about all of your senses. And then imagine walking through that scene that you've created and really taking in all of those details and relaxing in that place for several minutes. And they actually recommend doing this for about 15 minutes. But again, I would say just whenever you feel like you need to, go ahead and try to take yourself to that peaceful place. Now, a lot of times it's hard to come up with some of these. There are tons of apps out there now that some are free and some of them do cost, but they all, focus on relaxation, stress reduction. So some of these that I listed are on there. I personally have the Calm app, which I love. Typically, you get a free trial. I will say Thanksgiving's coming up. Last year, they did do a Black Friday sale where you got the whole year for about $30, and it was great. So I went ahead and did that, and I have not regretted it. So they have, relaxing sounds, they have meditations, they have different sleep stories. So definitely a really cool one. That I have personal experience using, but I'm sure these other ones also have some great content as well. So just some final thoughts. I think we want to practice acceptance. Again, thinking about what we can do that will help just prevent stress from setting in at the onset. Really trying to look for the silver linings, especially for my patients that come to me that have experienced a significant life change or a decline in something. We try to look for the silver linings. And again, celebrating small victories. So really thinking about what you've accomplished, what you've been able to do, rather than dwelling in what still needs to be done, can be the difference between wellness and stress. So I want you all to, hopefully take something away, thinking about what's one thing in your mind, planning out that goal setting that you're going to try this week to decrease your stress. Are you going to work on deep breathing? Are you going to try to connect with someone? Are you going to try to exercise? Are you going to focus on your sleep? But pick one thing, so a manageable, achievable goal that you can do to help decrease your stress. And then, as always, I like to leave my contact information. If you have any questions, you can certainly email me or call. But I appreciate everyone's time. And in respect for everyone's time, I will close. If anyone has any questions, let's see, I don't see anything in the chat box. You have my information. You can reach out to me, but I do appreciate everyone's time, and I hope you have a great day.
Thank you so much, Stephanie. That was some really great tips to help reduce stress. I appreciate it.
Absolutely.
Have a good day.